Good day, class. In this video, we are going to talk about the palpitation. Palpitation refers to an abnormal heartbeat that may be perceived by the patient. In a healthy person, we should not feel our heartbeats. But in this situation, palpitation, the patient will feel the heartbeats, especially the abnormal force and abnormal rhythm of the heartbeats. In a severe condition, the patient also may accompany by fear. So the patient may feel abnormal heartbeats and fear. This disease mostly is not constantly, so the patient may present as palpitation comes and goes. And the onset may relate to the emotion changes, especially anger or exciting. Sometimes it also may happen after overwork. Patient may present with palpitation and accompanied by chest tightness, shortness of breath, insomnia, poor memory, dizziness, vertigo, or tinnitus. Many medical conditions that may affect the heart rate, especially the rhythm of the heart rate. We can use the references from palpitation to treat, such as the tachycardia or bradycardia, or other diseases that are related to the heart. So you can use this session as your references. The etiology from acupuncture, we mainly focus on deficiency. It may be the qi, blood, yin or yang deficiency. This deficiency may result in the malnourishment of the heart. Mainly focus on the heart because palpitation is directly related to the heart. Once these aspects affect the heart, these are the endogenous pathogens. And apart from the deficiency, if there are some pathogens that affect the heart mind, it also may result in palpitation. So even from the treatments, we will focus on the heart, but the heart is related to the liver, the spleen, the kidney, and the lung. It relates to all other organs. For the treatments, most of the condition is deficiency, but in the meantime, we also need to consider if there's any other pathogens, such as dampness of phlegm, etc. The most typical symptom of palpitation is the sensation of irregular heartbeat. It may be accompanied by dizziness, chest tightness, irritation, fatigue, etc. Or even headaches. And then the headaches will depend on different causes. The patient may present as different type of pain. Also, it depends on the affected area. The pain may affect in different region. Heart yang deficiency. The patient will have the above presentation, but also in the meantime, the patient will have yang deficiency. Yang deficiency, the patient may present as cold extremities, pale swollen tongue due to yang deficiency, white coating, also yellow. Because the yang deficiency will result in internal coldness. That's why all these manifestations are actually due to internal coldness. Irregular or slow intermittent pulse is directly related to the rhythm of the heart. The heart and gallbladder qi deficiency. Qi deficiency, the patient may present as fatigue, spontaneous sweating, These are all qi deficiency. But when we use these syndromes, or when you diagnose these syndromes, you must not forget the chief complaint, palpitation. The heart and gallbladder qi deficiency may happen after fear, fright. It's because of the emotion of gallbladder. The patient may present as dream disturbed sleeping. So that's the possible causes. Fear. The heart and spleen deficiency. Spontaneous sweating, the spleen deficiency also may result in qi deficiency. For spleen deficiency, we can see from the tongue, teeth marks, loose stool, palpitation. Because of palpitation, we will focus on the heart, but in the meantime, if the patient presents as poor appetite, loose stool, the loose stool or dirt on the notes, you can just add loose stool or spleen deficiency. Indeficiency with deficiency heat. Still, which indeficiency? May be the heart indeficiency. Palpitation with the possible causes, overthinking, feverish, and overthinking may result in indeficiency, especially the heart indeficiency. Feverish sensation due to indeficiency. Insomnia, dream disturbed sleeping. This is due to the deficiency heat already affected heart. The rest are also the symptoms of indeficiency. So these are the common deficiency syndromes. The indeficiency with deficiency heat. Also, we need to focus on the indeficiency. And then the excess syndrome, so similar to the other diseases, we're going to focus on deficiency and excess. The heart blood stasis. So for blood stasis, you need to look for something that can present or reflect the stasis, blood stasis, such as something purple or bluish. So that's the blood stasis. You also may reflect in if the patient presents as headache, the type of pain. Water retention affecting the heart. That's actually also the excess pathogen, water retention. Palpitation, chest tightness, coughing with phlegm. Although this syndrome we named as water retention, but the water, as you can see when when you see the presentations, some of them are actually the phlegm. The reason is because although from the theory we can identify or classify phlegm and water or dampness clearly from the theory, but in the practice, the phlegm and dampness, they always comes together. You actually cannot tell me this patient presents with phlegm without dampness, because these phlegm and dampness are in the same category, although phlegm is thicker than dampness or than the water. So the patient may present as something with phlegm, dampness, water retention, edema, slippery coating, or dampness, greasy coating with phlegm. So it can be either phlegm or phlegm dampness with both. The treatment principles will depend on specific syndrome, but the general principles calming the mind, tonifying the heart, a combination of acupuncture and moxibustion, because the deficiency we can use a combination of acupuncture and moxibustion, reinforcing technique, especially for yang deficiency. We can use moxibustion to increase the heat. For yin deficiency, we don't use moxibustion because the yin deficiency may result in deficiency heat, so we don't want to aggravate the heat with either manipulation approach. The main points we can focus on the heart and pericardial meridians. One is directly focused on the heart, so the heart meridian. The pericardial meridians, when we study the basic theory, we said the pericardium is the protection of the heart. So we also can use pericardium. And then the related backstool points. The backstool points we always can use for deficiency. The deficiency of Zangfu organs. The front mu points or the front alarm points we mainly use for access. So points that you can consider such as heart 7, pericardium 6, heart 5, heart bladder 15. Bladder 15 is the point for heart, 心枢. Bladder 14, 厥阴枢. The points of bladder 15 and 14, these points are related to the heart, but also these points are local points, right behind the heart, on the back. Row 14, also local points. Row 17, the qi gathering points. For heart yang deficiency, we can always add row 4, stomach 36. These points we actually use for symptoms. So even for other diseases, if the patient presents with yang deficiency, you also can add these points. You also can use moxibustion on these points. The heart and gallbladder qi deficiency, 220, bladder 19. Heart and spleen deficiency, bladder 20, stomach 36. So we're going to focus on the spleen, tonify the spleen. In deficiency with deficiency heat, we can use pericardium 8. The 5 Su points. The second, Xing string points, can be used for heat. That's why we use pericardium 8. Pericardium 8 is the Xing points from the 5 Su points point of view. Pericardium 8 is the Xing points, Xing string points of the pericardium. So you can use this to clear the heat. You can use kidney 3 to tonify the kidney yin. The heart blastasis, pericardium 3, bladder 17. We have mentioned the bladder 17 for quite a few times. Whenever we talk about the blastasis, to activate the blood circulation, we can use bladder 17. For water retention affecting the heart, row 9. Row 9, the Chinese name, 水分, 水, SHUI, this is water. So whenever you see 水分, whenever you see 水, you can use for water. Row 9, spleen 9, 阴陵泉. For acute attack, a reducing manipulation technique, you can keep for 30 to 60 minutes or until the symptom disappear, which means you can keep much longer. So from this point of view, you will see the duration of the treatment is not standard requirements for 30 minutes. It may change according to different diseases or also according to different situations. The skin needling techniques and auricular acupuncture you always can apply. Apart from the palpitation itself, for the symptoms, we also need to consider the causes. Apart from these, from Chinese medicine point of view, of the deficiency and excess, Sometimes you also need to consider the medical history. If the patient is taking other medicine or tablets, even some Chinese herbal medicine, sometimes the palpitation may be the side effects of some tablets. So these are something you need to consider. You need to exclude the side effects of other medicines. A patient presents with palpitation, the Ecg examination is recommended. So if you can, you have to advise the patient to have the Ecg done. Then you will have, at least you will have a general background of the situation. Apart from these symptoms, sometimes you also can see if the patient presents with greasy tongue, chest tightness, insomnia, dream disturbed sleeping, constipation, yellow scanty urine, a red tongue, yellow greasy coating, watery slippery pulse. So if the patient presents at this, and then you can't find the symptom from these from the notes, you also can diagnose as the flame or flame heat or flame fire, and then you also can use the main points plus the points for flame, such as stomach 40, and or some points to clear the heat, liver 2, or stomach, the last second points from the stomach, or of the stomach 43. So these points you can consider. After studying all these diseases, your treatments may be very flexible. You can use the specific points for the specific syndrome. Although acupuncture can be used for palpitation, we can relieve the symptom of palpitation. But in the meantime, it is also very important to find the actual cause, and especially if the physical diseases of the heart. In the meantime, for the treatments or for prevention, we also need to advise the patient to exercise or to change, to have some adjustments from their lifestyles to avoid worry, anger, or fear. So sometimes how to avoid these, sometimes it's very difficult to avoid. So we need to ask the patient to exercise, to change their lifestyles. That can help to maintain or to prevent palpitation, or to prevent it becomes worse. The diseases that are directly related to the heart sometimes can be mild, sometimes also can be very severe. So it is very important for us to differentiate the diseases. For example, palpitation. If a patient in Chinese medicine, we always diagnose from the name of the symptoms. So palpitation, this is actually a symptom of the disease, but we have the diagnosis of palpitation in Chinese medicine. But when we diagnose palpitation, we also need to exclude other diseases or to differentiate other diseases, such as the angina pectoris or acute myocardial infarction. These severe diseases also sometimes may result in palpitation. In other words, palpitation may be only one symptom of these diseases, but those diseases are very severe. We need to be careful of that. In the next video, we are going to talk about the angina pectoris. Thank you for your attention.